Welcome to About Health. Today's segment is on hypertension. Our guest, Dr. Anthony Jones. Welcome to our program.
Thank you, Dr. Lenore.
What exactly is hypertension? I mean, people hear the term, but what does it mean?
So hypertension is synonymous with high blood pressure. And so it means that the blood pressure is circulating through our veins and our arteries is at an elevated state, and this puts a person at risk for complications later in life.
Why?
It's almost like a hydraulic system, a system of tubes and pipes. And so over time, with that system being elevated or higher than what it's designed for, we spring leaks. We can spring leaks just like we would in our pipes.
You know, I'm almost schizophrenic reading your internal medicine literature as to what the numbers are supposed to be. First, there was an article that said that we could raise the numbers to 150 over. I mean, everybody thinks about 120 over 80. But then one article comes out from the cardiologist says you can go to 140 over 90. What's your feeling on that?
So I guess the short answer is that it depends on the patient.
Right.
Because in certain populations, take diabetics for example, they do benefit from having a blood pressure that tends to be on the lower side of the goal ranges. But then when you look at a geriatric patient who might be at a higher risk for something like falling, with more dizziness and other types of conditions that can come along with advanced age.
Why do they call hypertension the silent killer?
Hypertension oftentimes is asymptomatic, and so a person can walk around with severely and even dangerously elevated blood pressure and have no symptoms. And in some cases, when the person does have symptoms, they're nonspecific or they don't really point to anything in particular.
What do you think a normal blood pressure should be?
I'd say a goal of the 130s in the systolic or the top number and 70s in the diastolic or the bottom numbers.
What are the risk factors for hypertension?
So certainly there are ethnic and racial risk factors. African Americans were at a higher chance or risk for developing hypertension or high blood pressure. Being overweight also confers an increased risk of developing high blood pressure. And also diet can play a big part in developing high blood pressure, and specifically salt in the diet. And that could be food that's frankly salty, as in using the seasoning, or processed food, which is oftentimes prepared with salt to help prolong its shelf life. In addition, there are other medical conditions like sleep apnea that can raise blood pressure, and actually it gets better when that condition is treated. But those are some of the more common risk factors for developing high blood pressure.
And your approach to reduce these risk factors includes what?
So certainly a person should monitor and get evaluated and get their blood pressure checked with their healthcare provider. If they do discover that they're hypertensive, then the first step and part of the ongoing treatment plan is what we call therapeutic lifestyle changes. And so that involves eating a healthy diet, one that's low in salt and high in fiber, fruits and vegetables, to maintain good hydration and drink plenty of water. And exercise is also really helpful, especially cardiovascular exercise. That can actually help to lower your blood pressure by 5 to 10 points just by doing regular exercise.
Are there some medications that are better than others, better tolerated?
There are numerous medications on the market now to treat hypertension, and so it's really important for a person to not give up. If a medicine doesn't sit well with them, or especially if it doesn't work, if it's not efficacious, then they should work with their healthcare provider to find the one that gets the job done and that gets along with an individual's body and it suits them.
Why do African Americans have higher rates of hypertension?
I think it's multifactorial. There tends to be a genetic component that's more than chance. In some cases, it's a lifestyle, and that may relate in some instances to the traditional diet that a lot of us, including myself, grew up on. My grandmother's good cooking tend to have a lot of salt and other types of food that may influence blood pressure. But at the same time, stress also contributes to high blood pressure. And I think absolutely, if you look at a person where they live and the social issues that they're struggling with, I would argue that those things do contribute to developing hypertension and perpetuating hypertension. So it's a bit of a mixed bag.
Dr. Anthony Jones, thank you for joining us. That's this edition of About Health.